Hello, thank you for taking the time to join me. My name is Sharon McMaster. I'm a children's occupational therapist working within the Belfast Trust. I will guide you through this brief presentation outlining how we as occupational therapists may be able to help your child. Our main aim as occupational therapists or OTs is to help your child participate in everyday activities to the best of their ability. As a service, we work with children from 0 to 18 years of age who have wide-ranging needs. The OT will work with you and your child to identify specific functional needs. They will complete an individualised assessment to explore any underlying difficulties your child may be having. In the next few slides, I'll talk to you about the different areas your OT may explore. This will, of course, be specific to your child's individual needs at the time of assessment. For younger children, your OT may look mainly at your child's play skills, assessing how they engage with toys and explore their environment. As OTs, we know that play is very important in the development of a child's motor skills. It helps develop problem-solving abilities and encourages their language and communication. For example, your OT may support you to develop your child's hand-eye coordination using building blocks or threading. These skills are fundamental and will be used by your child when they are older for activities such as using cutlery at meal times and opening packets of crisps, etc. A lot of children referred to our service have fine motor difficulties, meaning that they struggle with coordinated movements of their hands and fingers, which impacts on their functional skills. Things like play, pencil and scissor skills, or everyday self-care tasks such as dressing. Exploring your child's functional difficulties, the OT may need to assess aspects of your child's coordination. They may need to examine your child's motor planning, look at their core and shoulder stability, and assess bilateral coordination. This is the use of both sides of the body together. This will help the OT establish why your child struggles with activities like ball games, PE, or playing on equipment at the park. As children's OTs, we also get a lot of referrals for children experiencing difficulty with handwriting. Through assessment, the OT will explore and identify any underlying fine motor or perceptual difficulties your child may have. Just to note that if your child's difficulties with handwriting are purely due to a specific learning difficulty, their need may be best met by education as opposed to occupational therapy. I've briefly mentioned perceptual skills in other slides. The OT may explore your child's visual perceptual skills if they present with specific difficulties in relation to organisation, reading and writing. Once children reach a certain age, it's very important to develop their independence skills. If a child is struggling with self-care tasks, the OT will explore any underlying difficulties. They will provide advice and strategies to help you support your child to develop their independence with these everyday tasks. We all process and respond to sensory input in different ways, and it's important to be aware of your child's sensory preferences. For example, I hate the texture of rice pudding and really cannot tolerate the feel of knitted jumpers, so I would really struggle if I had to come to work every day in a woolen jumper. Thankfully, I can avoid these things and choose textures that I'm more comfortable with. It's fine to have sensory likes and dislikes. However, if your child is presenting with specific sensory needs which are impacting on their everyday activities, such as attending school, the OT will complete a sensory assessment. This may help the OT to identify sensory strategies to help support your child to engage in everyday tasks. So I've quickly highlighted many of the functional areas addressed by children's OTs and discussed some of the underlying skills we'll explore to best meet your child's needs. As you can see, we cover a wide range of functional areas. However, we are not a behavioural service and cannot address behavioural or attentional difficulties in isolation. Often children who struggle with everyday tasks may also present with reduced attention. However, if attention or behaviour is your main concern, it is best to raise these concerns with your GP or health visitor, depending on the age of your child. Here's a breakdown of the children's OT service. Once you've completed and returned the parent questionnaire, your child will be allocated an occupational therapist and you'll be offered an initial appointment, which will be a booked telephone consultation. Following this initial telephone call, your OT will arrange to complete a functional video assessment. This consultation will be using Microsoft Teams. A list of resources required for assessment will be emailed or posted out in advance, along with a guide to using Microsoft Teams. Following assessment, tailored OT intervention will be determined and provided. Within the Children's OT service, we've always encouraged parents to be active participants in their child's therapy. As OTs, we will support and guide you so that you can help your child develop their skills and maximise their independence and confidence with everyday activities. So go ahead and complete your questionnaire. If you have any difficulties, please contact the OT Admin Department for assistance. We look forward to meeting you and your child and helping you support your child to develop their skills. Thank you.